Hypertension, also known as high blood pressure, is a medical condition in which the blood pressure in the arteries is persistently high, putting extra strain on the heart and blood vessels. It is a major cause of complications such as heart disease, stroke, and kidney failure, blindness, and is also a leading risk factor for premature death. In Nigeria, hypertension is a significant public health concern, with prevalence rates on the rise, according to the report published by the World Health Organization. In 2018, it is estimated that 39% of Nigerian adults aged 25 to 64 have high blood pressure. Other studies indicate an overall hypertension prevalence of 28.9%, with a prevalence of 29.5% among men and 25.0% among women, among which 30.6% is from the rural dwellers, whereas 26.4% is from urban dwellers. Though there has been an established fact that the prevalence of hypertension is especially high at urban areas due to the increased consumption of processed foods, sedentary lifestyles, and lack of awareness about the condition. Apart from the numerous challenges militating against prevention of high hypertension in Nigeria, example, poor health literacy, health tourism, etc., the cost of management and related complications can be very expensive for many Nigerians. Efforts in the country to address the hypertension epidemic include awareness campaigns, access to free blood pressure screenings, training professionals, etc. But in spite of all these efforts, where are we today in the control of hypertension or high blood pressure, as the case may be? These and more we hope to find out even as the world marks Hypertension Day, with the theme, measure your blood pressure accurately, control it, live longer. This is Nigeria Today, and I am Ikaria Clinton. Thanks for joining us. Now, to shed more light on controlling hypertension in Nigeria, we have in the studio Dr. Aderonke Akande. She's the Acting Director, Disease Control, FCT Primary Healthcare Management Board. Glad to have you in Nigeria Today.
It's my pleasure to be here.
Now, also with us in the studio is Dr. Folashade Elizabeth Taiwo. She's a consultant cardiologist. You're welcome to Nigeria Today.
Thank you so much for having me.
Now, I will start with you, Folashade. Now, give us more insight into this health condition. We've heard a lot about it. Hypertension, high blood pressure is almost becoming a, will I say, household name. Because you do have a high blood pressure and you're hypertensive, you know, sometimes when you go to the hospital and they ask you certain questions, and some people will say, it's not my question, it's not my question. But tell us, give us an insight into the health condition called hypertension and why it's important to control it.
Thank you so much for the question, and thank you, viewers. We are celebrating World Hypertension Day today, and our theme is measure the blood pressure accurately, control it, live longer. Hypertension is a leading cause of cardiovascular disease and is a leading cause of premature death. So it is important for it to be properly checked and managed. Hypertension is persistently elevated blood pressure, as my madam has rightly said, persistently elevated blood pressure above 140/90. So, and it comes with a lot of complications if not properly controlled. We have two types of hypertension. We have the primary hypertension and the secondary hypertension. The primary hypertension is a component which is responsible for about 90% of hypertension, while the secondary hypertension is for about 10%. So it's most times it's primary hypertension that we see a lot, though we do see secondary hypertension too.
Yeah, I will come back to you on
Okay.
that, primary and secondary.
Secondary.
Now, to you, Dr. Adurunke. Now, before I will go on, the other question, I just want to get something clear. Could there be a difference between hypertension and high blood pressure? Is there really a difference?
Okay.
Really?
Thank you very much. This is a very important question. Someone can have high blood pressure without being hypertensive. When do we say someone is hypertensive? Hypertension means you must have checked the blood pressure on 2 or more occasions and found it elevated as high as 140/90 or and above. So when you do this, you can label that someone as being hypertensive. That means it has already been diagnosed.
More than once?
More than once. It could be twice, same day, or different days. It could be different weeks or months apart. But high blood pressure, it's a normal phenomenon. It's a physiological response to what is going on into your body system, like when you do exercise, when you run. So it is very likely your blood pressure is going to be elevated.
Or when you're frightened?
Or when you are frightened,
Okay.
yes. There is flight and fright syndrome, so you have to experience such elevated blood pressure. So you are not necessarily hypertensive when that happens. So all this needs to be clear to the people so that they don't mix it up.
Okay.
Thank
But it can also be used interchangeably. You have high blood
Yeah,
pressure.
we
and
do
high
use it
hypertension.
interchangeably, but technically they are different.
Okay.
Hypertension, when you are diagnosed hypertensive, that means you have to be on treatment. When someone is just experiencing what we call elevated blood pressure, which is high blood pressure, all you need to do is just to calm down. Sometimes we recommend to you, go and rest. Perhaps it's as a result of stress. So that is just the difference between the two.
Okay. Now, Volashadi, now tell us, what are the primary causes of hypertension or elevated high blood pressure?
Okay, thank you for the question. Primary hypertension most time has no cause, has no organ cause. So why secondary can be genetic? So primary hypertension has so many risk factors. So risk factors for primary hypertension include high salt diet, alcohol intake, tobacco smoking, obesity, physical inactivity, even stress. So those are the risk factors for primary hypertension.
Okay, they're not really, it's not really that it has a cause, but it has risk factors.
Yes, it has risk factors.
Okay.
Yes.
Okay. So how can you, now back to you, Adurunke, Dr. Adurunke, now how can you, diagnose hypertension early?
Okay, thank you once again. Diagnosis of hypertension can only happen when you go for screening. What do we mean by screening? Approaching health workers to check your blood pressure value for you. So, and this is what we actually encourage, that people should check their blood pressure from time to time. It is an exercise that everyone, so far you are about the age of 18 or 18 and above. So in those days we used to think, or science related it to us, that hypertension is a disease of old age. It's no longer the same. The trajectory that we are experiencing is not really palatable at all. You find a situation where a young teenager is suffering from stroke as a result of hypertension. So the age limit is now reduced to 18. So far you are age 18 and above, you are meant to be screening your blood pressure from time to time, because this will be helpful. And you don't necessarily need to be hypertensive before you do the screening, because you don't know the situation. Just like my colleague had rightly said, there are some situations or health conditions that could predispose someone to getting hypertension. So now you have to be screening from time to time, perhaps monthly or once in 3 months.
Yeah, I was about coming to that. How often?
Exactly. There is no particular one size fits all or a cast in stone to this. So all you need to do is just to base your screening on a particular schedule. Okay, my birthday is on the 18th or 14th. Just choose that particular date every month. Check your blood pressure, or 3 months interval. So it depends on you. But checking it is very important because you don't know when actually you might come down with hypertension as a result of different lifestyles that were stated before. So sometimes, you know, in those with primary hypertension, we know it runs in the family, and a lot of people will tell you, oh, my mother has it, my father has it. But someone who has other underlying health conditions that could lead to hypertension, so you can only pick it during this screening. So that is why it is quite important for everyone, everywhere you are, approach all those health centers. It is free, actually, most of the time. And some people move around. Those ones, we are not encouraging people, Nigerians, to be patronizing them, because you get to measure all sorts of values that we see on social media. So you need an expert, someone who is a health worker, to check for you accurately. If you look at the theme of this year's celebration, it's telling you to measure your blood pressure accurately.
Yeah, since you've talked about the accurately, tell us more about measuring accurately.
Yes.
Because a lot of persons measure their blood pressure.
Yes.
But how accurate is it?
There is an approach to measurement of blood pressure. So when, as a trained professional health worker, not necessarily a specialist or a doctor or a nurse, but someone as low in cadre as CHU, that's community health extension worker, are being trained from time to time to get blood pressure measured accurately. So there is a process, and this is you following this process before you can say, okay, I'm able to get elevated blood pressure and this could be hypertension. When you approach a health worker to help you check your blood pressure, you have to rest for some minutes. Regardless of what you are doing or where you are coming from, you don't just walk in and get the BP equipment, that's blood pressure equipment, fitted to your arm and off you go. No, you have to sit down for some minutes, get some rest. Then after that, the health worker will approach you with some instructions. And now we have it so easy with the digital SFIG. The BP equipment we use now are digitalized rather than the mercury type that we used to know. You put on the table and you know, look at how the mercury is rising. So everyone handles it. So now the process is that when you sit comfortably, you don't talk or move around while checking this blood pressure.
Even the machine will tell you.
Even the machine will tell you. So now you are meant to sit upright with your back rested. Then your 2 feet are placed on flat surface. You don't cross leg, you don't talk, you don't move or shift around while this is being done. So with that, the health worker also need to do some validation of the tool that they are using. So that is left for them as in the technical aspect, ensuring that the tool, the BP equipment, is in the right condition. So now the health worker will now put the cuff, the cloth part of the instrument, around your upper arm. And there is a measurement to that as well. There's a positioning as per where to put that particular cuff. We call it cuff around your arm. And the health worker will put the equipment at the level of your heart in such a way that there won't be discrepancy. And the 2 tubes that comes out from the cuff also has a way of placing it close to your brachial artery. So all these are technical terms which a layman may not really understand,
right?
but they count.
Okay.
So that's it.
Let me now bring in for Dr. Folashade here, because I know Dr. Adereke has a lot to say. So, Dr. Folashade, now I know you were talking about genetics and the rest of them. How do age, gender, and genetics what role did they play in influencing the likelihood of developing hypertension? One, then another one, I would also want you to tell us what are some of the symptoms of for you should be on the lookout for.
Okay, thank you so much for the question. For the age, hypertension can be seen in any age, as Madam has rightly said, but commoner in men below age 50 years, more than women. So it's now commoner in women after menopause.
Okay.
So women tend to have it more, at higher risk of having it even more than men after menopause. I hope I've explained the age difference and the sex. Okay, for the age also, the elderly can have hypertension too, because they have stiffening of their arteries. So you can see hypertension in elderly too. I hope I've explained.
Yes, that one is well understood. Now
Okay.
tell us, what are some of the symptoms that one should be on the lookout for, before for you to say, okay, this person is hypertensive. What are some of the symptoms?
Okay, thank you so much. That is the reason for our campaign, World Hypertension Day. Measure your blood pressure accurately, control it, live longer. Hypertension does not show symptoms most times. That is why it is termed a silent killer. It doesn't show symptoms. And those are one of the myths that we need to trash out. Some people will tell you, oh, I don't have symptoms, so I'm not hypertensive.
I'm very healthy.
I'm very healthy. Until you check. Until you check, that's when you know that you're hypertensive. Okay. So most times it doesn't show symptoms. But when it's severely elevated, so patients can come down with headache, nosebleed, vomiting, even weakness on one side of the leg may even be the first presentation of some people. Yes, you've seen it a lot of times. So that is why it's important to check the BP regularly. Check your blood pressure regularly. It's very important.
Okay, we'll have to just pause here and take a short break and listen to some people if they really know what they know, want to know what they know about themselves in terms of if they check their blood pressure and how aware they are about hypertension, as put together by Suleiman Abdul Wahab. Don't go away.
The day before yesterday, I checked mine. I was so satisfied by seeing that. Both the systolic, I don't know, and dialysis, I don't know how they call it. It's satisfying, honestly.
Yeah, because this will help you. It's better to know your health status than just dropping dead without knowing.
Can you use system and what is happening to your body? Because BP can kill, but if you are the one that is being controlled by it, you will live long.
Organization or individual, even though you work in places that they don't do that, when you on your own, is your health. Your health should be paramount. Like they say, health is wealth. If you don't take care of yourself, who knows? I lost a friend just by that. We were eating and it collapsed. We rushed him to the hospital. His BP was high, he died. So I've had a personal experience of somebody that I saw. We were the one that carried him to the hospital. We were eating in the canteen, then it collapsed. So
lack of checking up their own BP, of which is very, very bad. And I want to urge you today that please try your best and always visit any nearby hospital and check your BP.
Welcome back. This is still Nigeria Today, and we are talking about controlling hypertension in Nigeria. And of course, I have two health experts here with me in the studio. Now, I don't care. You had somebody there. Was so confused. That systolic, diastolic. So talk to us about that systolic, diastolic, and you know.
Okay. Usually, when you measure your blood pressure, the values will come in two. So the first one is called systolic,
which is the one at the top.
Which is the one at the top, and that's what the equipment, the value that it gives you when your heart contracts. Then we have diastolic. So diastolic is the value that you get whenever the heart relaxes. So you know, the heart is the machine in our system that pumps blood into every cell in our body. So there's a time of contraction, there's a time of relaxation. So when it contracts, so you tend to have high value because the heart is actually pumping against a lot of resistance through the blood circulation system, which is called blood vessels. So when that happens, we call it systolic period. Then diastolic is when your heart actually relaxes, and most of the time, most of those blood that are pumped into every cell, every organs and systems in the body find their way to return back to the heart.
Okay, having heard what you say, now tell us, if you now discover that you are hypertensive, so what do you do?
So this is a very important question. When you discover that you are hypertensive, you must seek for help. And where can that help come from? It can only come from health workers. Health workers in our primary healthcare facilities, secondary and even tertiary. So depending on where your location is and the proximity to any of these, once you approach them, there is a process to what you need to do. Being hypertensive does not mean you have to strictly be on drug forever. Sometimes you are going to be given a lifestyle modification counseling. So
such as?
It also depends on the value of the blood pressure that is gotten to say that you are hypertensive at least. So if the blood pressure value is mild and not so high, maybe 140/90, you could be counseled about, number one, if you are a smoker, you need to stop smoking. If you consume excess alcohol, you are going to be counseled to consume it in a moderate quantity that will not affect the blood pressure. Then if you are the type that live a sedentary lifestyle and probably are on obese side, you are going to be counseled on daily activity of trekking, brisk walking and exercise that will help you to lose weight. Then diet, specifically the amount of sodium chloride, which we commonly know as salt in our food, you are going to be counseled on how to reduce salt intake in your food. The moment you prepare a food and you taste it and you are tasting salt or Maggi in that food, that shows the volume of sodium chloride inside. It's a lot. So you have to stop eating such type of meal. Then rest is also advised. We mentioned stress as one of the risk factors for hypertension. So you're going to be counseled on having adequate rest and having enough sleep, like minimum 6 hours every night. So for children, they can have up to 8 hours, but for adults, 6 hours of sleep is okay. So all this lifestyle modification is very important to control hypertension that is not so severe. But if it is severe, there's actually simple medications that you could be placed on. You just take a little tab a day After your breakfast, off you go. You don't need to go back to it, and you actually live with optimal if you are able to control it, and you need to go for regular checkup every month to refill this medication.
Okay, I'll have to stop you there. So Falashade will just give us 30 seconds. What are some of the challenges that some of these hypertensive patients face in trying to control their, their blood pressure, and how can they, address it?
Well, the challenges they face in controlling their blood pressure, well, first of all, is one of the reasons for our campaign to measure your blood pressure accurately. Some of them don't get to know how to measure it properly, and that is one of the reasons for our campaign. As Madam O'Reilly said, their process. You sit down for like 5 minutes. You rest your back. You place your hand at the level of your heart. Okay, so you empty your bladder before your blood pressure take measurements. You should not take caffeinated drinks before your blood pressure measurements. So all those can affect. Some people just come from work, hey, my blood pressure. You won't get adequate.
Thank you very much. I know there's still much to talk about, but then this is where we draw the curtain for today's episode of Nigeria Today. A very big thank you to our two health professionals, Dr. Adironke Akande. Thank you so much for your time and for your input, and also Dr. Falashade Elizabeth Taiwo. Thank you so much.
Thank you so much for having us.
And thank you for being part of the program. Don't forget, Nigeria Today is weekday at 7:30 p.m. on NTA News 24. You can also check out this episode and others on www.youtube.com/NTA News 24 Hub. I am Ikeria Clinton. Have a wonderful weekend.